Check the mic and make sure it sound right, boys. It sound right, boys.
Boom, 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 boom. This is Jared and I'm back. Hey guys, this is the Warriors Quest show and I am your host, Jared A. Brown. Hey, thank you for watching. I've got Shane already saying boom, 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 because you know what time it is. All right, it's time for the boom, boom, boom. All right, we lay the hammer every Wednesday where we spotlight a chronic disease warrior who's often looking for a living kidney donor or a living donor in general. So tonight we're doing that, okay? This is my passion. This is what I love to do. All right, since 2016, all right, when I read a post from my sister-in-law on social media, I got inspired to help her. And since she became a kidney transplant recipient May 25th, 2018, I've been ever since, all right, involved with my advocacy and helping other people find a living kidney donor. And man, it's what I love to do. And this is not possible without your help. So don't be stingy. Please smash that share button. All right. So again, what I do every week when I do this is I spotlight somebody's story. We're doing that tonight with Tiffany Cloe. All right. I was able to get connected with Tiffany, found her information, and found her short video on TikTok. And we got connected on TikTok, and now we're going to get her story out there. All right. We've got Shane Blanchard, he's heavy on TikTok as well. Shane, I met Tiffany on TikTok. I'm gonna introduce her very soon. But before I do, I'm going to show just a glimpse. All right, so here we go. Is that our special guest has what's called Nail-Patella syndrome, and she has a father who has this and a half brother. So it's basically when someone has this, it affects their elbows or affects their joints, like their knees, also their hips. It can impair their vision. It can also cause problems, obviously, with their kidney. And that's why she's looking for a kidney donor, because it affects her kidneys and she's in kidney failure. And so I'm going to bring her on. Please smash that share button. All right. I want to see some clatter and chatter in the comment section. All right. Please continue to comment. Hello, Jonathan Trailer in the house. Thanks for watching, Jonathan. All right, so don't be stingy. Please share this so we can get this kidney warrior story out there. Again, she has Nail-Patella syndrome. Her kidneys have failed because of this condition. And now we're going to get her story out there and help her find a living kidney donor. In fact, we're going to hear her story, and I'm excited to do it. So I know she is young, Shane. She's very young. And so we're going to help this young lady. We're going to help her find a kidney donor. We need everyone to come together in the kidney disease community. Let's be strong together. Please click on the share button. Let's get this information out there. Share it in Facebook Messenger. Share it on TikTok. Share it on Twitter, Instagram, and any other platform that you can think of that I haven't already said. Let's get it out there. All right. Okay. So I'm going to bring her on. All right. Let's bring on our very special guest. And now we're going to get her story, and we're going to be able to have you guys involved in the chat, and let's get this going. All right, so I'm going to take away this overlay, and I'm going to do the VIP video intro. All right, let's get this place popping. All right, let's get it going. Let's get it lit in here. All right, we've got Lisa Baxter in the house too. All right, thanks for watching, Lisa. Here we go, VIP intro. For all VIPs, we do this, and she is a VIP. Here we go, VIP. Where's my mic? VIP.
Hello.
Hey, welcome, Tiffany. How are you?
Good. How are
Hi.
you?
I'm doing great. I'm doing really, really well. There's something about the month of December, right? I mean, it's magical, people that are often grumpy or in a good mood. And then you got people trying to find presents for people, which when you're giving presents to people, you're generally going to be in a better mood because you're thinking of other people, and so
Oh, definitely.
yeah. So one of my favorite times of the year, obviously, is right now, and so I'm doing well. But how are you doing?
I'm doing well. I'm doing really
Good.
well.
Well, I've given just a brief introduction, but what I'd like to do is I'm going to have you introduce yourself solo and just kind of let them know where you're from, where you're currently living, and
Sure.
let people have them get to know you a little bit and just kind of briefly introduce yourself. I'll still be here, but I'll put you solo, and then I'm going to show the chat as well so that you can see the comments that are coming up. Okay.
All right. Sounds good. Well, hello. My name is Tiffany Cloe. I am 33 years old, and I currently live in a little tiny town in Indiana called Freetown, Indiana. I was diagnosed with Nail-Patella syndrome at birth. My father is a spontaneous mutation of the Nail-Patella syndrome. So what that is someone who doesn't have a carrier parent and just randomly came about Nail-Patella. That's called a spontaneous mutation. When he and my mom were trying to have a child, they decided to get genetic counseling, and they found out that Nail-Patella can be passed on 50-50. So they kind of had an idea that I might have Nail-Patella when I was born. So I was diagnosed at birth. Some of my symptoms of Nail-Patella you talked about.
Mm-hmm.
The hip dysplasia. I have iliac horns. My
Is that on the
finger.
hips or where's
Yes,
that?
in the hips. Yes,
Mm-hmm.
the iliac horns are in the hips, and I believe, I don't want to say for sure, but I believe
Okay.
most of the people with Nail-Patella do have iliac horns, and they also have the thumbnails,
Mm-hmm.
which is a classic sign of Nail-Patella syndrome. And then I also have hypoplastic kneecaps, which are small and they sit off to the sides of my knees. I also have a younger brother who has Nail-Patella syndrome, so it's kind of been 100% in my family and not just the 50-50.
Oh,
Um,
wow.
yeah, so um, we all inherited the kidney portion. My dad, he was 10 when he had a kidney transplant. And my younger brother, he was 21 when he had his kidney transplant. And so I recently went into renal failure in May of
In
this
May
year.
of this year. Okay, I was going to
Yes, so
ask
I
how
was
long. Okay.
32 when I went into failure.
Okay.
So let's see. I'm if you have any questions so far, I could answer them.
Yeah, so what I'm going to do is I'm going to ask people to do that. So please ask a question. And let's get this going so that you can get to know her and so that you can get to know maybe even maybe answer questions about the Nail-Patella syndrome and how it's affected her.
Sure.
Um, so I've got some here we go. All right. So no questions yet, but what we'll do is so from what I'm understanding is that you went into kidney failure May of this year, right?
Yes.
Okay. So when that happened, um, did they? It seems as though what probably happened in my mind, and this is what generally happens initially, is they put the port like up here, the top kind of
Mhm.
on your chest. Is that what they did for you?
Yes, I do. I have a scar here.
Okay. Uh huh.
I did have an emergency chest catheter,
Okay.
and that was placed my second day in the hospital, and I immediately went to dialysis. Like, it was placed onto dialysis, and they did a full session of dialysis that day and then another 4-hour session the next day. But that next day, I had some complications at the end of my session that I had not ever experienced. And so
What do you mean by
they,
that?
I, about 16 minutes before my treatment ended, my whole entire body felt like it was buzzing, like it was vibrating, buzzing. It was a very scary feeling, and they stopped everything and they let me have a break, and they said that that was just anxiety, um,
Oh,
or
okay.
because I had never
Yeah.
experienced that
Uh
kind of
huh.
you know uh, treatment from my body that
Right.
it threw
Right.
me into like an anxious state.
Sure,
So,
right. Sometimes that can happen. I've heard of that many times where, whether it's a panic attack and you stop breathing, or sometimes our bodies will do something else
right.
besides the breathing part. Sometimes our bodies will, they'll put us we'll get fevered, or,
Mhm.
our body can manifest certain things when we're in sort of that condition. And I've heard of that before. So that anyway, we've got a question here. So Lisa Baxter, thanks. It's a great question. So Lisa Baxter has polycystic kidney disease, Tiffany, and
Okay.
so it's often called PKD,
Uh-huh.
much like sometimes Nail-Patella syndrome is called NPS,
Mhm.
right?
Yeah.
And it's genetic for her. Much of many of her siblings also have it. So she's asking here, how do your family, how do they deal with it? So is um is there really there's not necessarily medicine they put you on. It's just that you see a doctor regularly to make sure they can do certain things, or how can you answer
So
this question that
when
she's
I was
asking?
first diagnosed with kidney disease, I was 6 years old,
Mm-hmm.
um, and I was spilling a lot of protein,
Really,
and
even then?
yes. So proteinuria is my actual kidney diagnosis.
Mm-hmm.
And the protein over the years has damaged and caused the failure.
Mm-hmm.
But how does my family deal with this? So um, when I was around 9 years old, we moved from Florida to Indiana. So I could be at Riley Children's Hospital. I don't know if you've ever heard of that, but it's a very it's renowned here in the Midwest for
Okay.
treating sick kids. And so we moved to Indiana when I was 9. And my mom had me seeing a nephrologist at Riley Children's Hospital, and they had me on an ACE inhibitor and an ARB to minimize the protein in my urine.
Mm-hmm.
And then as I grew older, I just took an ACE inhibitor. I took lisinopril for a very long
Okay.
time.
All right.
And then
I'm familiar with
in
that.
2017 is when the progression of the kidney disease got worse. So from that time, I dropped from a 70 GFR to
Mm-hmm.
a 50 GFR.
Oh,
And
wow.
then that
20.
next year,
Wow.
I dropped from a 50 to a 30.
Oh my
And then
gosh. It
I
just kept
stayed,
dropping.
I stayed in the 30s, 40s till 2021, and then
Mm-hmm.
at the beginning of 2021, I dipped into the 20s, and I started getting uremic symptoms, and I started itching, and I was having a hard
Uh,
time breathing,
yeah.
and we didn't know because I am small stature, and my weight has always kind of been steady. We didn't know that the little bit of weight gain that I had was actually fluid weight
Yes,
coming
right.
on. And so when I went and had dialysis for the first time, I felt like a whole new woman, you know?
Right.
I was
Yeah,
like, I
get
was
some
up,
of
I was talking, I felt so good. And
right, I can
I ended
imagine.
up losing 10 pounds,
10 pounds of
10
fluid.
pounds
Oh my
of
gosh.
fluid in the
Yeah.
hospital.
Wow, yeah.
Yeah.
And the itching part I've heard from other kidney patients, that the itching happens. And so it
Yeah.
sounds like you had that as well. What about like
Yeah.
the taste? Do you
I
think
had not really a metallic taste. I
Uh-huh.
was getting like an ammonia breath. I
All
felt
right.
like I could smell ammonia or like cat pee all the time. Oh, it
Yes.
was so bad. It was bad.
So this is Shane Blanchard from Midwest Kidney Warriors.
Uh-huh.
He's pretty he's very active on TikTok as well. He's has a great sense of humor, and he just recently got a kidney transplant. So
Oh, that's wonderful.
yeah, he just recently got a kidney transplant. It was via um, a paired exchange program. So
Oh,
correct,
wow.
yeah. So correct me if I'm wrong, Shane, but I think it was his. Oh my gosh, I think it was his cousin, or it could be a nephew that donated his kidney, and then he was able to get a voucher, and within about, man, I want to say 2 weeks, um, he was able to get his kidney transplant after that, because of the
That's wonderful.
vouchers. Yeah. All right. So anyway, so Lisa Baxter had asked, I think maybe I saw Shane's comment. I got distracted. So, oh, pregnancy. There it is. So, when your mother was pregnant, did they have to do anything differently? Or do they just wait until the delivery, and then when you're a toddler, they check you if it's a 50-50 chance?
They waited until delivery. My mom and dad, though, had genetic counseling, so they kind of knew already
Okay.
what to look for. And so when I came out, my mom was like, "Check her thumbs, check her
Oh,
thumbs."
wow. So she knew to
Yeah.
look for that right away. Okay.
So yeah, she knew. But I did see. She said, "How is pregnancy dealt with? Are there any issues?" And I do know that some pregnancies may result in Nail-Patella if you are a carrier, and some may not. And I do know that if they don't, that doesn't pass on anymore. So it stops right there, you know.
Okay. Yeah. All right. So she, again, she's just saying, Lisa was saying that you look well, and she's also very impressed about how much you know about your condition and
Oh,
and
thank
the
you.
the Nail-Patella syndrome. Which is a great thing. We've got many people here commenting. I love it. Keep the comments coming, you guys, because it helps helps us reach more people. Any algorithm, whether it's TikTok, Instagram, Twitter, Facebook, YouTube, the algorithm will be in our favor and will be bound, so to speak, by us if we comment, share, and keep this active. So I appreciate that. So anyway, we're always talking about being our own best advocate, and the
Yeah,
best way to advocate for yourself is to ask questions and to be informed. And it seems like that's exactly what you're doing. So I applaud you on that. That's awesome.
thank you.
Yeah. So she hated the itching. She had it too. And I want us to give a shout out to Tanisha. Tanisha is also looking for a kidney, and she's been on the Warriors Quest show recently. High phosphorus can cause high itchiness. Yeah, that's right. That's
Oh,
right.
yes.
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 Yes. And all right. And Shane answered it was his cousin. I thought I remembered that right. Okay. Um, so and he's saying right here he donated you resources. Okay, where is it? All right. Anyway, I'll find it in a moment. So um he's even still bloated from the surgery. I thought maybe you'd have more time to get all that out, Shane. All right. So Tiffany, we also have Philip from A Second Chance watching. Philip is a kidney disease patient himself. His YouTube channel is A Second Chance. He's teamed up with Tafaro Cook, and they're Philip is in California. I'm forgetting whether it's San Diego or L.A. Um, and I think Tafaro is maybe in the somewhere in near Atlanta. I can't remember where he is from. But thanks for watching, Philip. And then we've got some more comments. 26 days post, and he says he's still getting gas. Well, that's that's not good at all. It sounds painful. So anyway, what we're gonna do is going to give some more. We're going to give them a little bit more information. So you've would you mind showing them your thumb? You were explaining to me
Sure.
offline that with the nail that your mother looked for your nail when you were a baby right away, and
Yes.
so
So the thumbnails are the worst, and
mm-hmm.
then as you go down the hand on Nail-Patella patients, the nails get better until they're like perfect nails on the pinky. And then actually on the toes, it's switched. So the pinky toes are the worst,
The
and
pinkies are the worst.
on the toes, yeah. And
On the
so
toes,
that's really,
gotcha. Okay.
and then also with Nail-Patella, you usually have like a crease right here on your knuckle.
Okay.
I mean, I'm
Uh-huh.
missing those creases on my top
Mm-hmm.
knuckle there. Um, Also with the nails, see the triangle lunae here
Oh, yeah.
instead
Kind
of
of comes to a peak. Yeah.
a half moon.
Mm-hmm.
That's another part of Nail-Patella.
All right.
Um, Glaucoma is prevalent in a lot of Nail-Patella patients. I don't have glaucoma though. I'm farsighted,
Okay.
and I had a lazy eye when I was younger, so that was corrected with glasses. Another thing is symptoms between patients vary drastically. So my symptoms are very different from my younger brother's. He was born with club feet, and he
Wow.
also has mild scoliosis,
Uh-huh.
and he also had a lazy left eye.
Okay.
His nails, he doesn't have nails. He's missing his thumbnails. Um,
Really? Okay, so
yes, that's part of it. Yeah.
all right.
We both have um the bent elbows, the dislocated radial heads, and
Okay.
we both have problems with our knees. Um, but yeah, we are all very different in how far our arms stretch out.
Mm-hmm.
Um, all three, my dad, my younger brother, and I, we have a shorter left leg. It's just all these little random symptoms go
All
together.
right. All right. And so this is this has been a very interesting, and it's been informative for me because um, I've been interviewing, kidney warriors for almost 3 years, and
Hmm.
every story is a little different. It's crazy. It's like
Yeah,
and this is the first time I've ever interviewed anybody with Nail-Patella syndrome,
it's
and it's
it's a 1 in 50,000 people.
okay, all right. I may have, at one point, maybe there was somebody in my school and had it, and I never knew about it. But
Right. Yeah.
yeah, but this is this is very informative, and it's great education to know about this. Um, so with even Tamika, thanks for watching, Tamika. She's saying she's never heard of it. Yeah, so your elbow and your arm, you can't straighten it out completely. Is that correct? Or how does that
Correct.
work for you?
Both of my arms only range about this far.
Okay, gotcha. All right. That's about as that's the that's about the extent of it is what I was going to say, but that's kind of
Yes.
ironic. Yeah, no pun
And
intended.
some nail patella patients are even more bent than that. They have what's right here, what's called tigerium. It's like a webbing,
Okay.
and so some people's webbing is a little tighter, and they have more
Interesting.
bent arms. Yeah.
Okay. Wow. So, and he's right. Philip's right. It's that does I could almost say that's exactly right. Is I could interview like 10 different people and get 10 different stories every single
Right.
time. So how does how did this affect you from a child to a teenager to an adult in regards to your I mean, you don't have anything to compare it to other than, other people, but how did this affect you growing up? Did did you because kids can be cruel.
Kids are very cruel.
Yes. So did anybody, when you were younger try to make fun of you,
Yeah.
and how were you affected in school in such a way?
So I bullying wise wasn't too bad. I always get picked on because I'm very thin. And
Mhm.
so everyone was like, you need to eat a cheeseburger. And I'm like, I'm naturally thin. This is just, that's what happens with Nail-Patella syndrome. Most people
Mhm.
are thin and short stature.
Yeah.
And so in school, I didn't take gym class. So everybody was kind of mad, why does she get to sit out a gym class?
Like you're
And
getting special treatment or something.
so I didn't take gym class all through middle school and then um, high school through till senior year. And then senior year, they changed the requirements and they had me take a modified gym class.
Okay.
Um, but my legs, when I was younger, gave out all the time.
All the
Like
time.
I would just be walking and my legs would give out and I'd fall down
Dislocated.
on the floor.
And at
And
that point, were they are is that like a dislocation, or and they have to be popped back in, or how does that
no, it just your legs just give out and then you just
Oh,
get back
wow.
up. But
Yeah.
it throws you off a little bit.
Sure. That would
um,
surprise me, yeah. I can
but
imagine that.
I've always been pretty active. When I was younger, I did a lot of rollerblading. I played piano, which they said, is really hard because of your arms and your hands.
Your fingers, okay,
Um,
yeah.
I used to bowl on the high school bowling team.
Right on, I love
So
bowling.
yeah, so I definitely didn't let Nail-Patella syndrome stop me from
Good for
doing
you. Good
anything.
for you. Good
So,
for you. A lot of self-determination, and and you've got a lot of moxie. I like that.
yes.
And in fact, so I'm gonna I'm gonna talk a little bit of something you say kind of struck me, and so I'm gonna talk about that. So
Sure.
when I originally, you came up on my For Your page on TikTok, the FYP, right?
Mhm.
And I, I watched your short video. Of course, they're all fairly short. It's TikTok, but um, the comments I started reading, and one of them, one of the comments, it was a question about whether you were in kidney failure because of drugs,
Right.
and you answered that like a pro. And I'm thinking, wow. I mean, if that were me, I'd almost be like mad or defensive that
Mhm.
if someone were to ask that question. It would, because that's how we are naturally as humans, is that when someone asks something like that, a lot of us would become defensive. Now, maybe you did and you just didn't put it down, then kudos to you if that's what really happened too. But I just want to commend you. And that's, again, um, a couple of things. Obviously, I wanted to help, and I do help people. That's why I reached out to you. But the second thing is the way you handled that question, and you basically clicked on the comment, and then you did a short video explaining it. But talk about that, if you would, for just a moment, and how what other questions you typically get. Do you think maybe she asked that because of your physique, that you're thin? That maybe she just automatically presumed that you were a drug addict because you're thin, or
I I'm not
I don't
sure.
get it. Yeah,
I'm not sure how they came about that,
yeah,
and, it did kinda catch me off guard
I'm
when
sure it did.
that was asked, but, my goal is always to share, my knowledge of Nail-Patella syndrome with others because so many people have never heard of Nail-Patella syndrome, even doctors. There are so many doctors out there who, are just blindly trying to find answers for maybe a
Mm-hmm.
patient who comes to them who has Nail-Patella syndrome. Because I was kind of in that position. I had a nephrologist who knew nothing about it, and here I am in my kidneys are failing, and I'm saying, I know my kidneys are failing and we need to figure out how to stop this. And he's saying, I don't even know what nail patella is. How am I supposed to stop this?
Oh no!
You know?
Wow. Yeah.
And he reached out, to other
Yeah.
doctors
All right. To get more info.
and there wasn't really a plan and that they could come up with that.
Mm-hmm.
And you can't really stop kidney failure. If it's gonna happen, it's gonna
It'll
happen.
happen, yeah,
So,
especially with something like this.
right.
If it's diabetes type 2, you can slow it down, by your eating habits and other things. But with Nail-Patella syndrome, there's not a whole lot of control from what I'm gathering. So Lisa's asking if you're going to write a book about this.
I've
Maybe it'll
never thought
become a
about that.
movie. Yeah.
Yeah, maybe.
So I love Lisa Baxter. Thanks for your comments, Lisa. Joe Ellen, a very loyal follower, and I love her comments. We all learn together. Thanks for your comment, Joe Ellen. Thanks for watching. So I'm going to put a comment by your brother again.
Yeah,
I don't know if you read that or saw that, but he
I
says,
saw him.
yeah,
Hello, Ryan.
thanks for watching, Ryan. So he says that that his hip pops out of socket for no reason as well,
Mhm.
and he says he's able to put it back in place. And so, is that painful when that happens, or is it more of just a shock or a
I
surprise?
I think it hurts. I
Okay,
think it hurts.
yeah. And is it the popping out of place that hurts, or both, putting it back in and when it pops out?
Um, I'm not sure, but Ryan probably could answer that for you
All
in
right,
the
all right.
comments.
Yeah, comment if you would, Ryan, and let me know if it hurts both when it pops out,
Because
or if,
my hips don't pop out, but everybody. in the
Yeah.
family is different. So
See, and Joe Ellen's asking how old, and and this, if it's too personal, you don't have to answer it for you, Tiffany, or Ryan. But she's asking how old your brother is.
Ryan is
Yeah.
26. He
Okay.
had his kidney transplant at 21, 5 years
Mm-hmm.
ago. So
Okay. Yes, she does. Beverly's saying Tiffany certainly knows enough about Nail-Patella to write a book. She's very knowledgeable. Go, Tiffany. So, this is the second comment we've had about that, and so I want to applaud you because everyone else is saying this is now the second time we've heard a comment or read a comment like this, and so we're always asking people to get informed, be inquisitive, and we say that not just because we want you to not trust your doctors, but even you yourself said that one of the doctors didn't know enough about it, right? And
right.
so so it's always important to ask questions, and even when they give you an answer, to ask again and get a second opinion. And we're always asking that, and you're very educated about this, and and it shows when it pops out. It doesn't hurt. I can't even tell when it pops out, but it's not going to hurt when you put it back in. Okay, interesting. All right. Thanks for responding to that, Ryan. So support groups. Lisa had asked, I think, a moment ago. I want to try to find it again. Here it is. Are there support groups with children that deal with this?
We currently have a couple groups on Facebook. One of them
Okay.
is Nail-Patella Syndrome Worldwide,
Worldwide.
and that
Okay.
is the nonprofit
Uh huh.
organization for Nail-Patella Syndrome.
Uh huh.
And then there's also one on Facebook just called Nail-Patella Syndrome.
Okay.
And they're both very helpful resources. I see posts every day from new people coming in saying, "Hey, I have these symptoms. I have not had an official diagnosis, but this sounds exactly like what I have, and I'm gonna go to the doctor and see if I can get a diagnosis for this."
All right, all right. Well, that's good. So, what's cool about a support group like that is it's kind of like right now where we've got Lisa Baxter, who was on dialysis for 12 years, and she's a kidney transplant recipient. Shane Blanchard just got a kidney transplant, and then we've got other people. Philip, who is a transplant recipient, and now he's also back. He's having to look for another kidney donor as well. But I guess what I'm trying to say, and I'll shorten this because I'm rambling a bit, is that when we have the comments from people that are going through what you're going through, or they've they've already gone through it, then at least for the kidney disease or kidney failure part of it, these people commenting can totally relate, and they have that in common with you. They may have experienced it differently, but they get it, and there's some commonality. And so a support group can be so important for people like that that don't have other people in the Nail-Patella syndrome world. Maybe they live in, I don't know, in a city that there is no other person that has it. And I so with the support group that you're talking about on Facebook, this Facebook group, then if they join that group, you're going to help them feel more welcomed. You know what I
Right.
mean? And I think that's
Mhm.
awesome because when we can find commonality and we can find that we relate, we don't feel alone. And it's a powerful thing when we don't feel alone. It gives us hope.
Right.
There's a light. All of a sudden the room's not so dark, right?
Mhm.
Yeah. All right. So I'm going to show some of these comments again. You can probably see them on the other side of the screen anyway. But Philip has a great comment I want to keep up there. I'm going to put up there. Hold on. Keep the comments coming, guys. Thank you. So he writes here, keep up the great work, Jared, and keep fighting the good fight. Tiffany, I have to get ready for tomorrow's show. definitely watching the rest of this in the morning. Everyone have a good night. Have a good night. Thank you, Philip, for watching and
Thank
for your
you.
loyal support. So, and Joe Ellen says, Tiffany, if this is too ignorant, please just skip over this. But is your stature small, short enough to be considered a little person or part of that community? Some symptoms sound similar.
I am 4'10", so I am not considered a little person, but I am little.
Yeah, nonetheless, yeah. All right. And Alan, oh my gosh. I'm going to give a shout out to Alan. Here we go. Tiffany. Alan is from Salem, Oregon, and he's on the search for a kidney as well. He's on dialysis, and he's looking for a kidney donor. A little fun fact about Alan is that he's very active physically. He's on TikTok too. So Alan, I'm gonna throw Tiffany's TikTok back on here. Hold on, and find her on TikTok. Here it is, Tiffany Cloe #2. Alan shows these short videos of where he's doing a bunch of pull-ups and different
Oh,
things. It's
wow.
amazing. Yeah, Alan is very inspiring to me. And thanks for tuning in, Alan, and watching the Warriors Quest show. I appreciate that. So anyway, so back to the way this condition affects you, and back to that as I wanted to talk about. So people noticed it when you were young. They noticed it when you weren't in PE, and that um, and then how does it affect you on a day-to-day basis connected to what your kidney failure is? Um,
Um,
I mean, because that alone gives you a bunch of things, like the itching that we talked about and other things. But
right. So
what do
I
you
deal
notice?
with a lot of nausea um, due to my kidney failure. I deal with nausea and vomiting a lot.
Okay.
Um, that and I'm currently on peritoneal
All
dialysis.
right. So you're doing
So,
PD.
yes, and I'm doing the cycler, so I'm on overnight. So I
Okay.
do 8.5 hours overnight, 3 sessions, and currently my labs are doing pretty good.
Mm-hmm.
Um, let's see, struggles being on PD and having Nail-Patella is probably lifting like the heavy bags and stuff. That can get really hard on my elbows. See, they just get really heavy.
Okay.
Um, I don't really have any other issues with, kidney disease and Nail-Patella syndrome.
Okay. So what about things like insomnia? Do you deal with that? Do you have a hard time sleeping?
Not really, no.
Okay. Good for you.
I used to in high school,
All right.
and then, now as an adult, I don't really have trouble sleeping, and I've been sleeping through my machine, which is
All
really
right.
good. Because at first it was really hard to sleep with the machine on, but
You've gotten used to it. Okay.
yeah.
Do you hear any of the beeps that may come on during the night if there's something that you have to fix or?
Sometimes.
Okay.
Sometimes, yeah.
All right. So we've got some other people. Comment in the comment section if you would, guys. If you currently do peritoneal dialysis, or you've done it in the past. So, doing peritoneal dialysis, have you ever been concerned, or have you ever had peritonitis, or have you done a pretty good job of making sure that's cleaned well enough where it's not a concern?
I am pretty sanitary and try to keep everything really clean. I make sure my shower head's clean,
Okay.
everything. And I haven't had peritonitis. Fingers
Good.
crossed.
Fingers
I know,
crossed. Right.
I know. So they say
Yeah.
it's not about if, it's about when.
When?
So, I have a peritonitis kit
Uh-huh.
just in case, but so far so good.
Okay. So Joe Ellen is asking how long you've been on PD. So your kidney failure started May of this year, 2021.
Yes.
And
Yes.
how how much longer was it that you went on PD? So did they started you on the cath, emergency
Yes,
cath?
I was in an emergency chest catheter,
Yeah.
and I started PD in August. So
Okay.
in from May to August, I did hemo, and
Mm-hmm.
that was really rough on my body. I was just wiped out after hemo every time. Just felt awful all the time. And then in August, I started PD.
Okay. So another good question from Lisa is, was PD your first choice? It more and more, and I'm happy to hear this. And I don't know if it's largely because of the pandemic, but more and more I'm interviewing people where it's being introduced to do dialysis at home.
Mm-hmm.
Did they give you options like the next stage home dialysis with a fistula, and then they talked to you about PD and they gave you choices, or how did that work?
They did try to set me up for a vein mapping when I left the hospital, and they also talked to me about PD, and I chose to do the PD and forego the vein mapping.
All right, all right. Well, other people that have chosen PD, it's worked really well for them. And I hope it continues to go well with you. Fingers crossed, no peritonitis so far,
Thank
right?
you.
Yeah. So she was asking if PD was your first choice. Did your dad and brother each do PD, or was it just you?
My brother did home hemo. He did
Home hemo
hemo in center
in center.
first,
All right.
and then I think the last year or so of his dialysis, he did home hemo.
Uh huh.
And my stepmom, she's an angel. She takes really good care of my brother and took great care of him on home hemo. And my dad, I not sure. I think he did hemodialysis,
All
but
right.
I don't remember.
All right. Well, speaking of which, Perry here says this is Tiffany's dad. I had my kidney transplant at 10 years old. Very proud of Tiffany and Ryan. So awesome. So he's watching. He's commenting. Thanks for watching, Perry, and thanks for tuning in. And so maybe if he's still watching, maybe he can comment and let us know if he did PD or if it was in clinic or some sort of home hemo. So Lisa Baxter has another question I'm going to show up here. Is it would you ever go on more interviews like the one I'm doing with you now, or do your own podcast? Would that be of interest to you?
I'd love to.
All right, great.
Sure.
So I'll get you connected maybe with some other people in this community.
Oh, great.
Jonathan Trailer that was watching earlier. I haven't seen a comment from him in a little while, but he also has a show that he does on YouTube. I can get you connected with him. And my twin brother does a show. Did I tell you I have a twin brother?
No.
Maybe I didn't. Yeah, all right. Yeah, I've got an identical twin brother. I'm about 8 to 10 minutes older though. So I can pull seniority that way.
Yeah.
All right. So yeah, I'll get you connected to some other people, and
Oh,
hopefully we
great.
can. Yeah, that way the more people we can reach, of course, the better, because that's the power of the internet. Is if we continue to share this, we have more comments in the comment section. If we get more people sharing this to other platforms, then it obviously just works that way. The algorithm kind of catches fire that way. I
Right.
And so hopefully we can do this. But if even if it doesn't happen on mine, and if it happens by sending you to someone else, it can happen. As I said before, I know it can happen because it's happened for me and two people that I've advocated for. And so I know this is a great platform to make this happen. All right, so here we go. Perry, your dad's commenting. So when I was diagnosed on 1974, if I'm
Mhm.
reading this right, I had
Yes.
peritoneal in the hospital. Um, So sometimes they do that with kids for children in the hospital. I went to Shands Hospital and had an AV fistula and was on hemo from 74 to February of 75, 3 days a week. Okay, interesting. All right, then we have here, this is Tiffany's stepmom. Hi, Carla. Carla is watching. Thank you for watching. This is Tiffany's stepmom. Ryan did pediatric dialysis in clinic for 2 years, then did home dialysis for 2 years until his kidney transplant. Interesting. Nice. So we've got the family representing here.
Yeah.
Nice. I love that. So what does it mean for you to have not only family members that can give you advice on Nail-Patella syndrome, but also kidney failure and dialysis? What does that mean to you, and how has that helped you, in your journey?
My family has been the biggest support. Just being able to call my dad, my stepmom, and my younger brother. They're all in Florida. Just being able to pick up the phone and call them and say, "Hey, this is what my lab work looks like." When
Yeah.
Ryan was going through this or when my dad was going through this, did they have sort of a similar reaction? What's going on? And just being able to, ask questions and understand processes and all that. It's really been a big help. There's a lot of uh, little ins and outs to understanding different types of dialysis
Mm-hmm.
and insurance
Oh my
and
gosh, right. That's
you
a whole
know
different thing.
finding kidney donor and everything. So just having those resources and that extra help is so worthwhile to me.
Very cool. So, um, man, I love the support. Not everybody has that. I've interviewed other kidney warriors whose families have become distanced,
Hmm.
and they've become estranged, and so it doesn't always work that way. And I'm glad to hear that you've got such a great, family, that you're grounded and you've got support that way. That's awesome. So right now, tell me a little bit about peritoneal dialysis. And you said earlier that you try to make sure that where you know, your catheter is, in your abdomen, you clean that well and you do your
Yeah.
best so that you don't get peritonitis. What do you how are you making sure that the room that you've designated to do that, whether it's your bedroom or wherever, how do you make sure that's sterile or clean when you do that there?
Um, just I clean the sheets every week.
Okay.
I make sure everything's swept, swept well, vacuum dusted. I use bleach wipes. Every time I go to set up, I put on a mask
Okay.
and sanitize my hands. I make sure I'm washing my hands before, I even go to sterilize anything. So I wash my hands multiple times a night. Set up, tear down, it's all very,
All
very
right.
sterile.
Okay, very good. Very good. So is this another family member or friend that's commenting right here, Laurel Ray Jones?
Yes, that's my friend Laurel. Hi,
Oh,
Laurel.
hi, Laurel. Thanks for watching and tuning in. So, the question I have for you is that when with the peritoneal dialysis, your machine, help me understand again if uh, if it's the type of dialysis that you don't have to worry about the dwelling during the day. Does it
Right,
with the cycler that you're on? It does that. It removes it and then it puts it back in all on its own, right?
right. So I was doing manuals and I
Uh
was
huh.
doing that 3 times a day.
Okay.
Um,
So you did
And
start out that way. Okay.
yes, and so now that I'm on the cycler does my 3 cycles for me,
Mm-hmm.
and then I don't carry fluid in my stomach during the day, like some people might, but
Yeah.
I haven't had to yet. So
All right, that's good. So,
yeah,
and then the cool thing is that a lot of people that either do home hemo or peritoneal dialysis, many of them have said that they feel much more refreshed than when they did in center because they're taking out the toxins more regularly instead of
yes,
do you know what I mean? Yeah, instead of doing 3 days a week, and when you're doing it 3 days a week, it's putting a lot of pressure on, a lot of stress on your body. And so if you're doing it daily, I can imagine that, that you're feeling a lot more in control. Number one, you feel like,
yes,
that you're doing it every day, and you've got control. It's at home. And if you do have to leave to go somewhere, it's a little bit cumbersome, but it's certainly better that you can at least pack everything if you needed to, and you can go
right,
somewhere.
right,
Whereas if someone's going in center, they've got to call in advance, way in advance,
mhm,
and make arrangements with the other clinic wherever they were going to, that's not easy, and it's not very convenient. So I could see some advantages that way, and so it sounds as though, especially right now, and you haven't gotten peritonitis, that this is a good fit for you, and that's good.
yes,
Do you feel like it not only keeps you more refreshed than when you were doing, dialysis with the emergency catheter, but that?
yes. I feel more refreshed.
Mm-hmm.
Definitely. I notice a huge difference between hemo and peritoneal dialysis and how my body felt after the hemo versus doing the peritoneal. I even told my husband, I said, sometimes when I wake up, I feel like I've already drank a cup of coffee. Like it has me energized and ready to
Uh-huh.
go. And
Gives you a little pep in your step.
yeah.
Yeah. Yeah, it's like you've been given like a big dose of vitamin B or something, or caffeine. Yeah. All right. So we're coming to the end just a little bit here, but um, I'm uh, I'm gonna ask just one. I'm gonna ask you to do one thing before we let you go. Is that
Okay.
so? I'm gonna change the chat where we're not gonna show the chat at the on the side here. And so at this point, what we do is I give you an opportunity to do what I call a shout out. Okay. And
Okay.
in the shout out, I'm going to change the screen a little bit. Here we go. So in the shout out, I basically it's the time to give tribute, to say thanks to family members, your husband, or to your friend Laurel, whomever you want to shout out, you know, um, anybody that maybe has given you encouragement, or anybody who's, been instrumental with your journey, not only with the Nail-Patella syndrome, but kidney failure. And so I'm going to give you just however long you want, whether it's just 30 seconds to a minute, however long you want, and just shout out people whom you're thankful for.
Okay. First of all, I wanted to say thank you for giving me this opportunity to talk about Nail-Patella syndrome and kidney disease. I want to thank my husband for being just everything, super supportive. He carries my dialysis boxes. He's wonderful, and I love him so much. I want to thank my dad and my stepmom, Carla, and my younger brother for always being supportive of me and for loving me and carrying me through this journey. And I want to thank my mother in law, Beverly, and my father in law, and my brother in law for being supportive members of the family and for caring about me and loving me. And I don't know if I missed anybody, but I also wanted to thank God because God has got me here today and helped me to be the person that I am. So,
Amen to that. Amen to that. Wonderfully said. Well said. So what I what I like to do is just I want to thank you for coming on. I know sometimes it's not easy to go on camera, and it's not easy to tell your story, but I thank you for it because now we can continue to have people share this. Your family can share this, your friends.
Yes, thank
Um,
you.
yeah, and we can get the information out there not only Facebook, but TikTok, Instagram, wherever, and we can get your story out there to as many people as possible. And if we continue to do that, whether it's a month from now or a week from now, it can still be shared. And that's
Right.
the beauty of the internet is it's going to be on my YouTube channel, it's going to be on Facebook, and it's going to be there. We can even click share. You'll see me sharing this 2 weeks from now because I try to keep it active, and I'll share it to some Facebook groups, or I'll share it on Twitter. And if we continue to do that, then you never know, okay, who maybe this might get sent to. But it has happened.
Mhm.
I've had somebody, I've had this shared to somebody who watched this another YouTube video, and the person whom I interviewed, the person felt like he was so inspired that he did want to become a donor for the person I interviewed. Her name is Amber
That's wonderful.
Pulver. Yeah, and the show was live in April of this year, and just like I think it was about 2.5, 3 months later, she got a transplant, and it was because of a YouTube video, an interview
Oh
like
wow.
this. And so it can happen. I can't guarantee when. It could happen a week from now, or it could happen next year. But I do know that this works, and I know that it does work if we're not stingy and we share. So let's keep on sharing. And I appreciate you coming by. I do. Thank you so much, Tiffany.
Thank you.
You're welcome. All right. God bless. And the only small ask that I have is that when you get that call, whether it's from a deceased donor angel or if it's from a living donor, from either a direct living donor or paired exchange program, just hit me up. I don't have to be the first person. Your husband should be the first person, or at least your family. But call me,
Yeah.
send me a text message, or send me a message on TikTok, wherever, and just let me know about it. Because as often as I can, I try to make a celebration video, and I'll go live and try to celebrate somebody's second, gift of life, and I try to celebrate that. So I'd be happy to hear about it. Okay.
Awesome. Thank you.
You're welcome. God bless. Have a great evening. Okay.
God bless you. Thank you.
Thank you. Bye bye.
Bye.
All right, you guys. So we've heard from Tiffany Cloe. Um, again, she has Nail-Patella syndrome. We've heard from her, and she's explained to us about that and how it's affected. It's affected her knees. It's affected her elbows and her arms, her eyes to a certain extent, where she had lazy eye when she was younger, and it's affected her kidneys. So she's had kidney failure. She's been on dialysis since May of this year, 2021, and she's now doing peritoneal dialysis. And we want to help her find a living kidney donor. All right, so let's do this. Let's unite. I know we're strong together. All right, so let's come together and help her find a living kidney donor. We can make it happen. I know we can. All right, so before I say peace, I'm out. I'm gonna look up and see. Here we go. All right. I've got one of my friends from D Live. Thanks. I know some people like me. I love being on camera, but not everybody does. She did a great job, by the way, Tiffany. If you're still watching, I want to commend you because you did a great job. You hit it out of the ballpark. You answered questions, and you did a great job. This person right here, the Auto Rocks, he's one of my followers and one of my friends from D Live. D is in David Live, D Live. And so we're streaming to about 22 other platforms on. I use Restream, and I'm streaming to Facebook, YouTube, Twitter, And then D Live is one of them, and that's how I've got connected to Auto Rocks. It's pretty amazing, what we could do with technology, and I appreciate you. I appreciate you watching Auto Rocks. Please continue to share this. And Joe Ellen, thanks for watching. Your comments are always appreciated. Thank you very much. And I want to say thanks to Lisa Baxter, Shane Blanchard, Jonathan Traylor. I want to say thank you to Laurel Ray Jones, for Perry, Donna Fears, Carla Thompson, or Carl Thomas, rather, Ryan, the brother, of course, the father, Perry Thomas. I'm going to go through this just one more time to make sure. Tanisha Ellis, thank you, Tanisha. Alan Hyder. And if I've missed anybody else Philip Jones. Philip from A Second Chance. And if I know there may be some other, Tamika was watching earlier. I want to thank her. Any other people that were watching but didn't comment, thank you for watching. And people who are watching this on a replay after it's live, thank you for watching. Keep this active, all right? Share it, comment more, leave another comment tomorrow, ask a question. And let's keep this very active so that the algorithm will be bound to us and it will be in our favor if we do that. The more people we can reach, the better of chance she has to find a living kidney donor. All right. Again, I do this every week and I'm passionate about it. I love it. I love doing this. I love helping people. I love making their stories, making them such a priority that people can understand them and then they can see their facial expressions. They can have empathy for these people that I have on camera. We did that tonight. All right. And I spotlight somebody every single week, and I wouldn't be able to do it without your help. So thank you. Let's continue to help Tiffany Cloe. Thank you again for watching. I'm gonna find the outro here, and I'm gonna say peace. Peace, I'm out. All right. Thank you again for watching. Peace. God bless.
Check the mic and make sure it sound right, boys. It sound right, boys.